Good day, good day, good day, good day, good day, good day, good day. So I'm back again. My name has not changed. It's still me. I'm a pharmacist, and I'll keep saying I'm very passionate about your health. As I said last week, July is a month set aside to raise a lot of awareness on liver health, and more specifically on hepatitis B. So as I started last week, if you missed any of the episodes, or if you missed last week's episode on how to protect the liver in general, please kindly go on our YouTube channel, subscribe to Consult Pharm-medic Ghana. You can also like and follow us on Instagram, where we have all the videos on, for instance, how to protect yourself, how to boost your immunity in COVID times, how to stay healthy whilst you work from home. You see all these health tidbits on our social media platforms, on YouTube, on Instagram, on Facebook. You get to catch up on all the related topics we've spoken about. Today, we're going to talk about alcoholic fatty liver disease. So why does alcohol destroy the liver? And why does alcohol cause inflammation of the liver and cause liver damage? The liver is the main organ that breaks down all harmful substances, and alcohol is one of the main factors or main substances that are very toxic to the liver. So the liver will try to break it down because that's its main job. So in the liver's attempt to break down alcohol into a harmless substance called acetic acid, it forms a harmful intermediate product called acetaldehyde. And this acetaldehyde is what affects the liver's ability to metabolize fats. So over a period of time, when you consume, or alcoholics consume, huge quantities of alcohol, it affects the liver's ability to metabolize fats, so that fats will start depositing in the liver, causing an inflammation. And that's the reason why it's called alcoholic fatty liver disease. One of the main signs that the liver is being destroyed because of alcohol is distended stomach. And when you see an alcoholic with distended stomach, please, it is not a sign of good living. It only means that the alcohol is becoming so inflamed to the extent that it's now leaking fluid out of its surface into the adjoining organ, which is the stomach. Also, it also means that the pressure in one of its main blood vessels that supplies it with blood, which is the portal vein, there's so much pressure in there so that the vein becomes distended, and then it also leaks fluid into the stomach. And this condition is called ascites. And sometimes an alcoholic will have such a huge stomach so that it puts a lot of pressure on the lungs, so the alcoholic won't be able to breathe well. Again, the fluid can accumulate so that it will become infected. Another also very important symptom that shows that somebody is having liver failure due to alcoholism is a condition we call encephalopathy. This is a brain disorder where the person starts having trembling hands, is confused, has coordination problems, and this can be seen with a lot of alcoholics who are drinking a lot of alcohol. Why does this happen? This is because the liver is the main organ that, after the breakdown of proteins into amino acids, it converts leftover amino acid into ammonia, and then ammonia is furthermore converted into urea. But in a diseased liver, due to alcoholism, the liver is not able to convert the ammonia into urea, and ammonia crosses something we call the blood-brain barrier, and it's very harmful to the brain. And this is the reason why for alcoholics, they start having brain-related problems like the trembling of the hands, like confusion, and then it looks like they are not able to think properly. Another very important symptom that shows that a liver is failing for an alcoholic is that they could bleed through their orifices. You could see end-stage liver damage in an alcoholic. You see they could bleed through almost their mouth, their eyes, their nose, everywhere. It's because the liver is the main organ that is responsible for the manufacturing of what we call coagulating proteins. And they could easily bruise. So you could see an alcoholic and the skin looks so frail that the slightest thing they will bruise and they will start bleeding excessively, because the proteins that are responsible for clotting, or the clotting factors, is mainly done by the liver. So without the liver's ability to manufacture these coagulating proteins or clotting factors, somebody who is alcoholic can easily bleed to death. Again, One of the very main symptoms you see in alcoholics is dark urine and pale poop, for instance. And this is also because the liver is the main organ that actually breaks down bilirubin. And the accumulation of bilirubin is what leads to pale poop. It's the same accumulation of bilirubin that could lead to the yellowing of the skin, the yellowing of the eye. Somebody who is alcoholic and is having liver failure could also feel severely tired all the time. They are losing weight. It's because the liver is the main organ that's a storehouse for energy, or our energy hub, glucose storage. And glucose is usually stored in the form of glycogen. So when you need energy, the body depends on the liver a lot. In alcoholic liver damage, because of the failing liver, the liver is not able to perform this role. So an alcoholic will feel always tired and he will lose a lot of weight. So these are some of the main symptoms associated with alcoholic fatty liver disease. It is very, very important that we know our limit when it comes to alcohol consumption. Under normal circumstances, in layman terms, you are not supposed to drink more than 2 units of alcohol a day. That's the average of 2 average size club bottle. And then we are not supposed to drink in a week more than 14 units of alcohol. So we need to take note of that, and we need to protect our liver. It is very important. The good thing is that the liver always gives us a second chance. So when you're an alcoholic and you stop drinking alcohol, the liver could start repairing itself to 100% of its potential. Thank you so much for your time. We'll come back next week to talk about another aspect of liver disease called non-alcoholic fatty liver disease. God bless you. Have a wonderful week.